Let's talk about surgical versus a non-surgical rhinoplasty. What are the pros and cons, the advantages and the disadvantages, and what are both techniques really like? I am Dr. Karishma Kagor, board certified plastic surgeon at Dr. Karishma Aesthetics, and we are going to discuss about rhinoplasty in length. Now let's start with a non-surgical rhinoplasty. A non-surgical rhinoplasty is a technique where we use hyaluronic acid fillers and inject it onto the nose. It is a 5-minute procedure. We apply a numbing cream on the bridge of the nose for about 30 to 40 minutes before doing the procedure. Since it is an outpatient procedure, it is non-surgical, even the results are temporary. These fillers will last you for about 12 to 18 months and they start dissolving in the body. Why and when do we use these non-surgical fillers? It is mainly used to make minor changes in the shape of your nose. You can use it to raise the tip of your nose, add a height to the nose for those who have a very low nasal height, increase a little bit of projection in the nose. Also, if people have a deviation in the nose which is very minor, these minor corrections can be made using these fillers, and this is what we call a liquid rhinoplasty. The downtime is very short. It is a 5 to 10 minute procedure. You will have a little bit of redness and swelling on the nose for about 4 to 5 days, for which we provide you medications, and it is a walk-in walk-out procedure, literally a lunch break treatment. We do not tend to see much of bruises and any severe side effects or complications, and it is for those people who have a fear for the nose job surgery, have just minor deformities in the nose, for which we can use these non-surgical fillers and correct the shape of your nose. When we talk about surgery, a rhinoplasty surgery is a major surgery where we have to make certain cuts in the nose and expose the nose to make structural and actually permanent changes in your nose. If someone is having a very severe deformity of the nose, could be also having an internal breathing issue, they could be having a very large hump on the nose, a very drooping nose tip, a very broad nose bridge. They could be also complaining of bulky, bulbous or very thick nose tip. Some people have a very wide alar flaring also. Now, these could be very major issues which sometimes cannot be corrected with the non-surgical fillers. The non-surgical fillers are purely for helping to sharpen the nose a little bit, correct minor deformities, also help to make the nose look a little slimmer if that is what you want. But if you're looking for more permanent structural changes, and if you have a very thick nose skin, also we cannot opt for the fillers at times, and then we will suggest the actual nose job surgery or the rhinoplasty surgery. If you also have it combined with an internal breathing issue, then we call it a rhinoseptoplasty. We will have to correct the deviation in the nose along with the external aesthetic changes on the nose. So a rhinoseptoplasty will combine both procedures, the aesthetic rhinoplasty along with the septoplasty surgery, which will also correct the breathing issues that you have. And a surgical rhinoplasty in general will correct all of the changes right from the bone onto the cartilage, and these structural anatomical changes can only be made by surgery and the results are permanent. Yes, because it is a surgery, it has a little bit of a longer downtime as compared to the non-surgical rhinoplasty. The surgical rhinoplasty will have you wearing a plaster on the nose for about 7 days. After 7 days, I remove the plaster and then I start you on nose tapes, nose massages. The swelling and bruising in a rhinoplasty surgery is a little longer than the non-surgical. 3 to 6 weeks of swelling is expected, and you have to have a lot of patience when it comes to rhinoplasty. You need to wait for the swelling. The best results of a rhinoplasty are anything from 6 months to even 1 year. And you need to do regular nose massages, wear your tapes, and you will get to see that your results are improving month by month. Those persons who have a very thick skin on the nose, oily skin, sebaceous skin, or a very large, very big nose for which we are making it small and reducing in size, those patients especially tend to have a little more of a prolonged swelling than someone who has a thin to medium thickness skin, less oily skin. So for these people, we prepare them before surgery. We actually prepare the skin, try to reduce the oiliness and oil secretion, provide them with topical creams, medications, and then get them prepped in for the actual surgery. But those with very large noses, thick skin noses, you must expect a little bit of swelling, slightly longer than 2 to 3 months as compared to another person. The healing time of rhinoplasty in general is 4 to 6 weeks. It's not that you need to sit at home just because you're healing. The swelling is something that you and me will be more concerned about or will be aware about. However, for somebody outside may not figure out the swelling. After about 2 weeks for the girls, I tell them you can put on your makeup, do a little bit of makeup camouflage and head out. So, to summarize what we spoke today, surgical versus non-surgical rhinoplasty, you have both the options. You need to gauge which is it that you want. Something temporary, something you can repeat again and again, that's the liquid rhinoplasty. You want something more permanent and an actual structural change in your nose, then you have to go for the surgical rhinoplasty. If you have breathing issues involved, then you would have to go for surgery and do a rhinoseptoplasty combined. When we talk about non-surgical treatments, the downtime is less. The surgical treatments, you have a slightly longer downtime and healing time. The non-surgical procedures walk in, walk out, whereas the surgical rhinoplasty has to be performed under general anesthesia most times, and in some cases where just a minor tip correction is needed, we even do it sometimes under local anesthesia. In the non-surgical rhinoplasty, you will see that the results would fade away within 1 to 1.5 years. The surgical procedure is a permanent procedure. It is in a very rare circumstance that there could be minor tweaks and revision surgeries that are needed, could be years later. Also because as we age, our bones age, cartilage age, and you can have drooping of the nose. But it is rather a permanent procedure with very rare side effects and complications. So I hope you understood a basic difference between surgical and non-surgical rhinoplasty. Finally, the decision is yours and mine combined. You need to always consult your plastic surgeon, come to us, meet us, have a detailed conversation so we understand what you desire and what kind of results are you looking for, what are your expectations and what are the possibilities and the reality that I can provide you. So if you want to know more about rhinoplasty and you are looking for a rhinoplasty, do get in touch with our team at Dr. Karishma Aesthetics. We are in Indiranagar as well as our second branch in Whitefield, and we can talk one-to-one and understand whether you're fit for non-surgical or a surgical rhinoplasty.